Okay, the next system is the neurological system in the physical examination, and we start that part of the examination by doing the cranial nerves. So the first cranial nerve is the olfactory nerve, or the sense of smell. And so the way you test that is you have the patient close her eyes, and then you pass something that smells under her nose. So in this case, what does that smell?
Blueberry.
Okay, so I had blueberry hand sanitizer, and spot on there. The next cranial nerve is the optic nerve, which we checked that in the beginning when we were doing the Snellen chart and visual acuity at the eye assessment. Then there's the ocular, motor, trochlear, and abducens nerves, which all check the extraocular movements that we did on the eye exam earlier. Then you do the trigeminal nerve. So you're gonna, for the trigeminal nerve, you're gonna do the corneal reflex, which we did with the cotton ball at the beginning of the exam. Then you're also gonna check, so you clench your teeth. You're gonna check for muscle strength in the teeth, and then you're also gonna look at her face. And if you notice drooping to one side, then that's also a sign of an abnormal trigeminal nerve, like in Bell's palsy. And then the next, you're going to do the facial nerve. And so you're going to have her lift her eyebrows, make sure that they're equal. You're going to have her smile, grit her teeth, frown. You're going to make sure all of that is equal. Next is the acoustic nerve, and we tested all that when we did the ear exam earlier. And then you've got the glossopharyngeal and the vagus nerve, and that's got a lot to do with swallowing. It's also got the bitter and sweet taste on the tongue, but you're gonna have her like swallow her own spit, make sure she doesn't choke. And then you got the accessory nerve. So that's all to do right here. And a good way to check that is for her to shrug against resistance, which she can do. And then the last is the hypoglossal nerve. Sorry. And so to do that, it has a lot to do with the tongue. So you have her stick out her tongue, make sure it's midline, and then we can move on. Alright, so the next thing we're going to do is test fine motor skills. And so the rapid, rhythmic, alternating movements is a good way to do that. The good example that the book does is patting the knees. And so we do, you pat with your palms and then with the other side of your hand. And so we're going to do that. And then you're going to, of course, alternate the palm and the top side of the hand. And then as you go on, you're going to speed up. And her being able to do that is what we expect to find. The abnormal thing would be if she couldn't do it, or if she were stiff, slow, or just was not able to have that coordination. Those will all be considered abnormal. And then another good way to check her fine motor skills is for her to have her close her eyes and have her hands out, her index fingers pointed, and then to touch her nose, and then to do it with the other hand. And so you would have her repeat that a couple of times, and you can stop. Her being able to do that is normal. The abnormal would be if she were to point to some other part, or if she again became stiff or unable to do so. Those would all be considered abnormal. Okay, next we're going to do the equilibrium test. Okay, so she's going to stand up, and can you see her? Okay, and so in this test we're going to have her stand up, of course, like she is. She's going to put her arms at her side and her feet together, and she's going to close her eyes. You're going to be really careful to make sure that they don't fall, because if there is something wrong with the equilibrium, she would be swaying, or she might actually even fall over. And then you can have her open her eyes and separate her feet by about a foot apart, and then close her eyes again and check for swaying. And so she just told me that she felt like she was swaying. So that's considered abnormal. Even though I can't actually observe her moving, she can feel herself doing that. Okay, and then you can sit down. Okay. So the next is her ability to tell me what an object is with her eyes closed, just by tactile recognition. So close your eyes, and I'm going to give you something. I want you to tell me what it is. Alright? Okay, so what is that?
Pen.
Okay. And Then I'm gonna give her something else. What is that? Shoe. Okay. So that's normal. You know, you usually go on like a stress ball or something, but abnormal would be either a delayed response and her trying to tell me what the object is, or her not being able to tell me that at all. Okay, so the next part of the neurological assessment is actually the assessment of the gait. And to do this, we're going to actually watch her walk. So this is all about the coordination of walking. So you look at her feet and you want to make sure as she walks, walk slowly, Mama, that she's walking one foot in front of the other. Slow down, Mama. And actually the foot hits the ground and then you're taking off on the balls of your feet. And as you're taking off on one ball of the foot, you're actually, as you're taking off on this ball of the foot, you're actually putting down the other foot. So, Mama, walk slowly and show. You can see that it's just alternating one leg to the other, which is, okay, you're done. Which is, lots of people are not able to do because it is a highly coordinated skill. So next, we're going to do the primary sensory functions, and we're going to kind of practice over here on her ankles, okay? So look down here. The first thing we'll do is superficial touch. So I'm going to touch her with my finger somewhere, and she's going to tell me where it is. So, and she's up here with her eyes closed. So, Mama, be specific. Where am I touching you?
Outer right foot.
Okay. And where am I touching you?
On the ankle of the left foot.
Okay. Okay, so the next one that we're looking at is superficial pain. And what I'm going to do is, whenever I touch you, Mom, I want you to tell me if what you feel is sharp or dull. And so to do this, I'm going to use the sharp side of the scissors versus the dull side of the scissors. So you give the patient about 2 seconds to respond, and whenever you ask them. So, Mom, is that sharp or dull?
Dull.
Okay, is that sharp or dull?
Sharp.
Okay, is that sharp or dull?
Dull.
Is that sharp or dull?
Sharp.
Okay. Okay, next we're going to check with vibration. So for this, you're going to put a vibrating tuning fork on over a bony prominence. This, we're going to do the ankle. You can do the shin, the sternum, the wrist, the elbow, any place, and you're going to put the vibrating tuning fork over on the bony prominence, and then have the patient tell you where it is and where they feel the vibrations. So, for instance, where is that, Mom?
Right ankle, right outer ankle.
Okay. Where is that, Mom?
Shin, left shin.
Okay. And so that's just testing the vibrations. Did you feel it vibrating anywhere else?
Mm-mm.
Okay. Next, we're going to do reflexes, and the first reflex we're going to do is the biceps reflex. So you're going to take the arm, put it on the tendon, and then you are going to strike and get your lovely reflex. Next is the brachioradial, and you are going to move down the arm and strike the tendon there and get your reflex. Next, you're going to move to the tricep reflex, and you're going to hold the arm under the tricep and strike down toward the elbow and get your reflex. Then you're going to move down to the legs. Ideally, the leg would be hanging in the air. Let me give you an extension. And you're going to strike just under the knee and get your reflex. And the last one is the Achilles reflex. And you are going to hold the foot up and strike the back of the foot kind of close to the heel on the Achilles tendon and look for your reflex there.